Welcome to Roots of Resilience, the podcast where we break down the systems shaping behavioral health, higher education, and leadership without feeding the beast. This is Friday, the day before Love Day. Happy Valentine's Day to all of you guys out there. And I'm your host, Dr. Tarina Knight, Doctor of Behavioral Health, Integrated Behavioral Health Care Leader, and Lean Six Sigma Green Belt Professional. I am the CEO, consultant, and coach for Virtually Renowned Consulting Access LLC, and I'm your guide through the chaos towards clarity. Let's go ahead and get into today's breaking story. Campus mental health is improving on some measures, but don't pop confetti just yet. Recent national student data shows sustained declines in severe depression and suicidal ideation versus 2022. Yet, over one-third still report moderate to severe symptoms. That's kind of unique, right? Now, let's look at what Health Mind Study had to say. So, the 2024-2025 Health Mind Study reports severe depression is down to 18% and past year suicidal thoughts down to 11%. It's containing a 3-year improving trend. Still, 32% report moderate to severe anxiety, and more than half report loneliness. Institutions report expanded services. So, more accredited counseling centers, more year round staffing, more formal return from leave programs. There are clear gains in the Princeton Review in 2025 Campus Mental Health Survey, so go and check that out. But the progress and prevalence can coexist. Don't mistake better for solved. Now, because we got funding from Biden, we implemented programs where there wasn't programs, we still have to question, what does the workflows look like? What does the process and procedures look like? Because all those things impact the policies and procedures that are created by those that are in leadership and are implemented, that then impact not only the students, but the faculty and staff that have to serve them. Now, we know that if we're not keeping our faculty and staff stable, they're going to bring chaos to our students, and it's going to be projected off on them, which means that not only the students' family or social factors they came from and brought to college with them that still exist, and now gets added to all these factors of the campus. And we have to keep that in mind, especially if we're advocating for better behavioral health and healthcare outcomes. Because we know the first thing that changes is diet. When diet changes, it throws everything off. It makes people crave sugar, salty things that can increase the chances of hypertension as well as diabetes. We even have people that overeat that leads to obesity and then has a trickle effect with the other two, diabetes and hypertension. But we also have a correlation there with things like cancer or respiratory based factors. And those things can worsen if our diet isn't where it needs to be, because our body needs to be fed in order to heal, and it needs to be fed with the right things. So my hat goes off to all my nutritionists out there and my pathology, neuropathology individuals that study those particular things, but also those naturalistic based, static based factors that they are studying out there to help people with the foods and vitamin supplements they need to survive. So my hat goes out to you guys. It is a work in progress. You are going up against pharmaceutical companies and all of sorts. And what I can say is, from my own personal experience, is sometimes there needs to be a collaboration between pharmaceuticals and vitamins. Because what happens is, if we can get the vitamin supplement into the body and increase these factors for individuals while on medications that help with stabilization, sometimes we may be able to taper the person off of medicines and replace it with the things the body knows, right? And then there's those of us that our bodies just get into confusion state and just want to attack itself with medication. So for some of us, medications shouldn't be the first thing we go to. It really should probably be the nutrition and the supplement based factors. So with that said, let's go over into a very important aspect to improving health outcomes for individuals on campus or across the world. Here, especially in the United States, we created the 988 process. It's a helpline and it's being used for our campuses. So 988 on campus is considered a lifeline or a letdown. Let's talk about that. So, New JAMA Network Open analysis states that 988 generated millions of contracts. So, we have million of individuals that work as behavioral health specialists or crisis level professionals that got into 988 to work and help individuals that were from various different areas. They could call in or text and get support. 2024 incidents, 23.7 per thousand, were wide regional variations. So awareness and funding does matter because in certain areas the funding isn't as valuable as other areas may lack at particular things. So we have to be aware and basically leading to across the board level of access. Now, among college students, a 2025 peer reviewed study found low awareness or usage, over 56% unaware of 988. Isn't that something? I tend to put it in my posts sometimes or even comments when I see certain posts that is starting to talk about things that you know or feel like someone may need immediate level of support. I'll put it there. And I am challenging other professionals in the behavioral health field that is within the social media platform to do that as well because people need to know about it, right? So only a tiny level of fraction had used it. So that's a marketing and integration process. And we can help with that as professionals here in the social media world. But if you're not in the social media world, know that you can provide this number to your patients and also create flyers for your community and put them up. And that's what I'm going to challenge myself to over the next week is creating flyers that can be placed up in the community so that individuals around me know about it and know that it is accessible to them. The Lifeline research portfolio shows effectiveness, but warm transfer into campus supports is pivotal. So let's look at make 988 visible on the syllabi or portals. So the RA training, map warm offs from 988 to campus to local services, making sure that those individuals across this world can actually know about and have access to, and especially here in the US. And I keep saying that. Next up, let's look at what actually helps now. So these are some things that we found through research that is helping now. First, nurse led and integrated approaches show promise in 2025 systematic review. Use them for tier 1 to 2 early intervention and case findings. And I like that because nurse-led and integrated approaches helps our patients way more than anything else. Holistic care is it. If you're not treating the whole person, you don't care. And I'm saying that. I'm throwing that on the line. You're just out there to make money. You have to provide holistic levels of care. And just like me as a consultant, my process has to come with a holistic approach. And that's what I do. I know sometimes it seems a little one sided, but that's the whole key to keeping the special stuff in because you got vultures out here that's willing to take your ideas at any moment and not give you opportunity. So I say, if you want to know what my plans are, come and join me, purchase some things, get to know me, and you'll find out about a lot of things. Yes. Collaborative care has the strongest evidence base, okay, for integrated behavioral health. Adoption is growing, but payment or coverage varies. And that's always been the biggest thing. Healthcare providers, insurance providers, and the battle between the two still goes on today in 2026. And what we have to realize is that these are things that impacts people's ability to obtain access to the services and care that they need. And my wish, as Dr. King says, I have a dream, is that one day we can have a payment system that truly matches the shared concern that it states it has instead of just donating money. Wouldn't that be nice? Okay. So for youth with co-occurring needs, a 2025 RCT found integrated community teams performed as well as hospital outpatient care. So it's not do more, it's do what works, right? And I'm going to repeat that. It's not do more, it's do what works. And we know what works through research. And we can create pilot programs that we can actually go out and experiment a little bit of ourselves. And that's what I'm about. I'm about identifying things and gaps through research and then create what I like to call is a pilot program that can be utilized or tried out just like when people received that funding for behavioral health, they had no problem with implementing it because they received money, right? Even though that nice breakdown they gave to the government to receive the money probably doesn't even exist today. That is something to be said, and a realization that we must have about the field in which we are in and how it works and flows. So, next up, telemental health is durable. Adolescents, nearly 45% receiving mental health care used telehealth in 2022, with the highest use in office based specialty care schools. I love it. Kids can now get the help they need without being seen in the community, and that's the most beautiful thing ever. The other thing that makes this whole virtual base untrustworthy is the fact that people can hack you and things like that. Here's what I have to say. We can all try to discredit one side or the other. Going to an office can be discredited, just like telehealth can be discredited. What should matter is what's more comfortable for the individual, right? And trying to talk them out of particular things, sometimes it really isn't going to work out the way we think. It will most likely lead them to not want to receive any level of service versus reaching out and getting the service they need. College students, large study on a virtual therapy platform shows reliable improvement, remission with minimum racial ethnic outcome gaps. Wow, isn't that amazing, right? And mostly because some of these programs actually allow the students to participate in their sessions as avatars and not really themselves. And I love the creativity. My goal is that we have more platforms, and there are some out there today for leaders to use avatars and participate in groups and things like that. But that's something that's a goal for my organization is to utilize more avatar based things, take people through a very good vetted identity based process and then allow them to participate as an avatar because what the thing is that we want to be helpful, we want to be supportive, and we want to meet them where they are, and we want to get the information we need to be able to help them. Now, many of us in the field, I can say over the years, I never had problems with getting what I needed from the individuals to be able to help them, but some providers and professionals do struggle with that. And my goal is to build my business by making income that comes off of my products to then now expand to giving jobs to others, not this whole game of loans and grants and all these various different things. Because, as they say, violation of privacy and people hacking you increases even more. And we want to reduce that as much as we can. So APA 2025 guidance exists for college telehealth, licensures, FERPA, HIPAA, crisis planning, and even vendor contracts. Now, this is Valentine's Day weekend, right? And Frederick Douglass chose February 14th to celebrate his birthday. His mother called him her little Valentine. How sweet, right? So many Black schools later marked Douglass Day, okay, as an important milestone. Love plus liberation right on the calendar. I love it. This brings me to my closing for today. Put 988 and campus crisis info on every LMS homepage and syllabus. Audit your warm off map from housing, counseling, community providers to your interactions with students. Know that Virtually Renowned Consulting Access LLC is there to help you. And you can put that in any search engine and pull up my website, which gives you access to how you can reach me. And until then, follow me on social media. I do most of my posting on TikTok at Never Feed the Beast because that's the objective. Never feed the beast. And to those of you that never fed the beast, my hat goes off to you because you have mastered the mindset of boundaries, job roles, and etc. Work hard and stay peaceful, you guys. And please come back and join me for the next episode on FERPA versus HIPAA. Where does the line really fall? I keep honing in on that because that's some really important stuff here that I want you guys to embed into your brain. So until next time, I'm Dr. Serena Knight, Doctor of Behavioral Health, and please go ahead and get on my calendar for any consulting and coaching services needs that you may have. I'm here to support you in making sure that we integrate behavioral health into that process in the best fashion that improves the workflow without burning out any of your staff or faculty.